what I would always advise any member is to call the number on the back of your card. Customer service will have the knowledge and the insight to be able to say, okay, that specific device is going to pull to your prosthetics benefit. You have a $20 copay once you meet your deductible, or whatever the determinants of that plan might be.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefit systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
For this episode, we're joined by two leaders on our clinical team. Lorene holds both bachelor's and master's degrees in nursing with 15 years of experience, 10 of which were spent in an oncology setting. Stephanie holds a master's degree in public administration and has more than a decade of experience working in clinical settings and within the insurance industry. Together, they lead the clinical and non-clinical processes that impact the medical management of an insurance plan. We're glad to have you both with us to discuss medical devices and benefits.
Thanks for having us. Thank you for having us.
Thanks for joining Sarah and I. Durable medical equipment, prosthetics, and appliances are categories of medical devices. They all serve a different purpose and might have varying costs associated with them as covered or uncovered benefits of your plan. So let's start with durable medical equipment, or DME, yet another acronym in our industry.
Well, and Jolene, this is one we added to the glossary of terms we started because DME is another thing that you might hear people talk about, or they reference equipment and it shows up as DME someplace. And if you don't sit and do this all the time, you might not know what DME is. So I think it's a good definition. But as we started the process of DME, we uncovered that not all medical equipment or devices are considered durable medical equipment. So I feel like this is a good topic to discuss. So DME, if I'm right, refers to medical devices that are used repeatedly and are primarily for medical purposes and are appropriate for home use, like wheelchairs, hospital beds, walkers, oxygen equipment, and CPAP machines. But it doesn't include, news to me, a bathtub seat or a raised toilet seat, since those items don't have a medical purpose. But I have two questions. This category also includes crutches, a wrist brace, or an ambulatory boot that you might get at the orthopedist office, or you might pick up if you have a mom injury like I do from a surgical supply store. Is that right?
Sometimes when I think about what's considered a DME versus a prosthetic, I feel like those lines can get so blurry and gray and subjective from person to person. So I would also like to know who makes those rules. But to answer Sarah's question, crutches would be considered durable medical equipment. However, the wrist brace or an ambulatory boot would actually follow the prosthetics category, which seems crazy because if we're thinking of a device that's used for medical purposes that you can use again, those are usually what we consider, quote unquote, to be a DME, which you can use a wrist brace more than once. But
right.
The broad definition of what's considered a durable medical equipment versus a prosthetic, that's what impacts how we consider those devices and then the subsequent benefits that they would fall to.
When my brain thinks prosthetic, which I didn't even think of as durable medical equipment, and I understand it's a totally different category, so processes differently. But yeah, I thought prosthetic is prosthetic, like artificial limb or, appendage or something like that, not the walking boot.
Right. And if you really want one, you mentioned my background with oncology, some plans through different insurances, a scalp prosthetic would be a wig. So if someone with cancer lost, was losing their hair, some plans, and it would have to be for a scalp prosthetic. Isn't that wild?
Yeah.
Crazy.
Who would know that?
Exactly.
But does that mean it is then potentially covered under the plan? Like it would be written into the plan that something like that would be covered or not covered?
Yep, correct. Yeah. Yeah.
But you would look for a wig under prosthetics.
Correct. Yeah. It was very few and far between. So probably less plans even now, but that's a thing. It's a thing out there.
Like my brain wouldn't have even, I understand it now that we're talking about it, but on the outside, I wouldn't have known that could be a covered item, but even to start to know where in my benefit plan to look for something like that. So how do you figure out, if you're a member, what is covered or not covered, or if it's a DME or a prosthetic, because that could be written in your plan differently.
Yeah, my advice, and what I would always advise any member, is to call the number on the back of your card, because if you have whether it's a script from your doctor that's giving the code for the wrist brace or description of the item or benefit that they're requesting for you, customer service will have the knowledge and the insight to be able to say, okay, that specific device is going to pull to your prosthetics benefit. You have a $20 copay once you meet your deductible, or whatever the determinants of that plan might be for the benefits associated with each benefit. But customer service will always be able to advise members if the device itself is even a covered benefit, if it requires authorization, where they can get it from, because that's another consideration too, is if you're getting crutches or a wrist brace, you're going to want to make sure that you're getting that through a par provider, through your insurance, to make sure that you're maximizing your insurance benefit. So they could also direct you, because if a doctor gives you a script for crutches and says, go wherever you want, that's fine and dandy, but there's some providers that are going to be in network and some that are out. So as a member, you always want to make sure that you're going in network, just so you're maximizing your insurance benefits.
Yeah.
So one
and
thing
every plan is, go ahead. I was just going to, every
ahead.
plan is so different that it might be specifically, it's through pharmacy A versus pharmacy B, and pharmacy B might be more of a mail order one. So you're not picking it up at this 24-hour place, but rather it's getting overnighted to you. So there's just so many ins and outs that you have really no choice other than to call, because how would the average person, let alone the above average person who works in the industry, doesn't always know the ins and outs, because all plans are so unique.
One of the things I wanted to point out that you noted here is characteristics.
Yeah, I can read those off. So DME, durable medical equipment, are generally identified as being durable, so they can withstand repeated use. So crutches, you can use them day 1, day 10, day 15, hopefully not that long. Medical purpose, so used to treat a medical condition. So this is where we can deviate in that there's certain devices that may be considered not covered as durable medical equipment because they're not used to treat a medical condition. They may be considered what we call a convenience item. So the aforementioned raised seat for the toilet could be considered a convenience item if it's not used to treat a medical condition specifically. Other things like that could be a hot tub. We do occasionally get requests for a hot tub, which that's a convenience item because it can be used for both leisure as well as potential medical conditions. So we're not going to get into that. So it's considered a convenience item. Long-term use, so a device that's generally intended for long-term use rather than short-term or disposable use. So something like a sling, that's not considered DME. That's usually one and done. And then non-surgical. So a DME device is usually non-surgical and non-invasive. So you're putting it on your body. It's not going in your body. That sort of example. So wheelchairs, hospital beds, walkers, oxygen equipment, CPAP machines and supplies, all of that fun stuff is all considered DME.
So question about my walking boot, because I feel like it can withstand repeated use. It was used to treat a medical condition. And we're all hung up on this boot. Oh, generally intended for long-term use rather than short-term. Maybe that's the differentiator, because it's non-surgical and non-invasive. So maybe we look at prosthetics. Can we talk about prosthetics?
Yeah, because I think
a prosthetic then.
Yeah, I think to your point, Sarah, the boot fits a few of the criteria points of DME, but it also, once we talk prosthetics, you'll see it even more so fits those characteristics, because prosthetics as a whole are generally for a replacement. So if it's replacing a missing limb or body part, so if somebody does have a above the knee amputation, a prosthetic would be that artificial limb customization, so tailored to the individual's needs and physical characteristics. So if someone's getting like custom made orthotics or any knee braces or leg braces, and then also restorative, which I think this part especially is the walking boot, aims to restore normal function or appearance to the extent possible. So your walking boot, you're using it for maybe a few weeks, aim to restore your normal function. It's broadly more so a prosthetic in that regard then.
Yeah, and think of how it's fitted to you, right?
Right. That's
so everyone can't wear the same. So that's where we all think of the artificial arms and legs, prosthetic hands or feet. But that also includes, artificial eyes or even breast prosthesis post-mastectomy, right? Because it's including the surgical bras that's aiming to restore normal function or appearance as best as possible. Yeah, it's a whole confusing world, and that's why we're here to help answer questions, both from that number on the back of their card, but also the nurses and anyone here, because it's confusing.
So we talked about medical equipment, DME, and prosthetics. But there's another category of things that didn't even jog my brain until we started talking about how can we explain DME to understand what is included in your medical plan, and that is medical appliances. I love a third category in the mix.
I know.
So those are devices that assist in supporting a body function or structure. So my brain wants my walking boot again. They're often used to support, align, or improve the function of a particular body part. But that's things like orthotic devices, hearing aids, pacemakers, or orthopedic shoes. So appliances is category 3. What is happening here?
So, right, like you can see where plans can spread it out, right?
Yeah.
Because some don't call out all 3, they bundle them in. So this is a third one. I can tell you these characteristics: supportive. It provides support to a body part, often used in the orthopedics. The functional improvement. So it's aiming to improve the function or stability of a body part. Non-custom. That's our key change here. Non-custom can either be custom made or off the shelf. So I think we had that example earlier. You think of like a wrist brace.
Yeah.
You can walk into the pharmacy and purchase a wrist brace versus it being ordered for you or customized. So examples here, we mentioned those braces and splints, the hearing aids, the pacemakers, those orthopedic shoes, and dental appliances such as like a retainer.
So I have a question for whoever they are. Why is my massage gun isn't covered? And that restores my function. I need to use that sucker on my back every day. 40.
But you can use your HSA, or you can use your FSA dollars to pay for your massage gun because it is covered there.
I can never speak enough on these. If your plan offers them, I will get on that soapbox all day, every day to go ahead and take that and store away that money, those pre-tax dollars, because this is when life gets confusing. And is it DME? Is it this? Is it that? Is it covered? How much of it is covered? And even if it's not, like your massage gun, you have that money that you've been storing away for these purposes. Certainly, if your plan offers FSA, HSA, and I know there's other topics on those to learn more about them, but use those dollars.
Yeah, 100%. And I know we link out a lot on our website to FSAstore.com, like links and tools and things like that. And they really do a nice job of outlining what is covered and not covered for FSA and HSA. So when we consider the broad category, the 3 different sets of items we talked about, first, they need to be determined to be medically necessary. So if my wrist hurts and I go to the drugstore to buy a wrist brace, that won't be covered under my plan because I don't have any record that it's medically necessary for me to have that. But if I sprain my wrist and get a wrist brace at urgent care or through a medical provider, I would assume it's more likely that that'll be a covered item, ?
Yes.
Yeah.
Yeah, I would agree. And then to Laureen's point, like she said, like certainly if you're in a I don't want to name names, if you're in a big pharmacy and they have those wrist braces, you can certainly use your HSA, but I don't know if you'll be able to present your insurance card and have them run it through that way. So I would agree that the greatest benefit return is always usually going to be through the health insurance. So certainly those benefits are still owed to you if you use your HSA or FSA, but going through the health insurance is always going to be the greatest benefit return because whatever item you are prescribed or is going through your benefits, that will apply to your deductible. So that's always what I encourage members to do is to go through the health insurance plan, because even if there's something that's in or out of network, it'll still go through your deductible and apply to that cost share that you'll have through the rest of the year.
Just to summarize, so DME focuses on durable, reusable equipment for medical purposes, primarily for home use, not institutional use. Prosthetic, replace a missing body part to restore function or appearance. They're usually custom made to fit the wearer. And appliances or orthotics support or improve the function of a body part. And they can be either custom made, keyword, or off the shelf.
Yeah, I think that's clear as mud. I feel like we've all got it.
But
There's a quiz at the end. Yeah.
Thank you both, Laureen and Steph, for joining us.
Thank you for having us.
thank you.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.